Welcome and thank you for joining us. I'm Lindsay Mastis with WTOP's Get on Top of Your Health, and today's guests are Rick Desper, a patient at George Washington University Hospital, and Dr. Zach Levine, a professor of neurosurgery at George Washington University Hospital. Thank you both so much for joining us today. And Dr. Levine, you work with leading edge technology and you work with so many different conditions. Tell me a little bit about what you focus on as a neurosurgeon.
Well, in my brand of neurosurgery, I treat people with movement disorders and epilepsy, and that includes Parkinson's disease, essential tremor, something called dystonia, and then seizure disorders.
It's a lot of different things, and we have a patient of yours with us today, Mr. Desper. Tell me a little bit about what you were going through and the reason that you came to Dr. Levine.
Well, what I had what's known as an essential tremor, that my hands were not capable of staying steady, and if they needed to be steady, like if I was trying to hold something still, it would get worse. So that made it hard to do things like drinking hot liquids or do fine tools or things like that.
And how long had you been experiencing essential tremors?
Well, the symptoms first appeared when I was a teenager, and then they were gradually getting worse over the last couple of decades as I, entered middle age, as we say.
Yeah, and whenever you mentioned a lot of the things that were difficult for you, like how was it trying to write your name, for example?
Well, I basically gave up on having a consistent signature. Like I just wave my hand in the pen and there'd be some kind of blob on the paper. So, no, yeah.
Yeah, and so Dr. Levine, when you first met Mr. Desper, did you know right away if you'd be able to help him?
Usually from a symptomatic perspective, yeah. We do even just a cursory exam, I could tell that this was a tremor that could be treated, but then there are a couple of hoops that the patient has to jump through for us to make sure that the treatment will work.
Okay.
So that it takes more than just an exam and a history, which is very important in what I do, but it takes a couple of other radiographic studies and a couple of other historical things for me to put together to determine what kind of treatment and if it would be successful.
And so, Mr. Desper, what was it like for you, going through that process?
Oh, it was pretty simple. Background and walking around and stuff like that. Simple tests.
And then there's a CT scan, which you probably didn't even remember, that we get to screen for the how dense the skull is. And the skull has to be of a certain density to allow the ultrasound waves to pass through the skull efficiently. And that's a little bit of a physics argument, but gets a little too science fiction sometimes. But without that, I really can't predict whether this treatment's going to work.
And tell me some more about the treatment, because this is, for a lot of us, this seems very technologically advanced. What's it called?
It's called MRI-guided focus ultrasound, and it is really the marriage of MRI scans and ultrasounds to do an incisionless operation. So traditionally, this surgery is done. You have to make a hole in the skin, you've got to make a hole in the skull, and you have to put either wires or a probe into the brain, and that imparts a lot of risk. But with this new procedure, we're able to, without making an incision, without making any holes in anything, allow the ultrasound to penetrate through the skull, and we aim the ultrasound at a specific target, and we know this target through years of experience with patients with certain disorders, and when we hit that area with ultrasound, we can stop the symptoms. So those cells that we treat no longer are putting out the abnormal signals that are causing tremor or other symptoms.
And is this something that fixes it forever, or is it a temporary fix?
That's a great question. So we have, because we've only recorded 5 years of ongoing data of the same patient population, and so far we have noticed at least a 5-year durability. So and that is, the tremor is reduced by an average of about 73% in every patient for at least 5 years. So that's our current durability.
Okay, and is the patient awake, or are they out for this procedure?
So the patient has to be awake. The reason for that, and luckily it's not a painful operation, but I guess Rick can tell you more about that, but the patient has to be awake so we can assess how successful the procedure was, and do we need to do more, or have we done enough?
And Mr. Desper, what was it like for you while you were going through the procedure?
Well, I mean, it's kind of a procedure where you're just trying to stay still for an hour lying on a bench on your back. So it's like mostly boring, just sitting there waiting for something to happen. And then when something happens, it's like, oh, exciting, and then it gets boring again. And, and it's a cold room too, so that's frustrating. But
was there a point where you noticed that there was a difference in the tremors?
Actually, it was pretty immediate. After we did the first treatment, he said, okay, well, hold out your hand and draw these circles I drew these circles before the procedure, and then he had me draw them again, and suddenly I could have the line, I could have it stay within the boundaries, and it was like, wow. So that was great.
What was that moment for you like?
It was fantastic. I mean, it was like, oh my God, this thing that has just been an albatross on my health for decades, it's just not there anymore. So it's great.
And how was it through, the whole process of just coming to George Washington University Hospital, and your follow-ups?
I mean, it was fine. It's a good hospital. It was convenient. There are nice people there, so.
There's a very nice doctor there.
Yeah, it's a great doctor.
Yeah, and this is incredible to hear. There's a lot of patients that maybe haven't heard of a procedure like this. What, Mr. Desper, what would you want other people in your situation to know?
I would want them to know that if they've had a tremor, and it can be, people with tremors, we know how bad they are, and they're kind of embarrassing. We feel like it's something we've done wrong. There is a modern treatment that can help you deal with it, and suddenly this condition that I've had for decades is like, it's just not there anymore. So it's life-changing, I'd say.
And Dr. Levine, what do you want patients to know when they're thinking of doing a procedure or wanting to even contact someone like you?
Well, you can certainly contact George Washington University Hospital, and they can set up an evaluation. And we evaluate you, and the vast majority of people who come to see me with essential tremor are candidates for this. The vast, vast majority. People with Parkinson's disease, a lot of them are good candidates for this. And it's something you should at least look into. And there are some limitations, but they're very, very few.
Mm-hmm. And let's talk a little bit more about some of the other procedures that you treat. You do a lot with very incredible technologies, things that are kind of brand new. What other technologies are kind of on the horizon? We talk a lot about artificial intelligence, for example. What are you seeing is the future in neurosurgery?
Well, so for artificial intelligence, we're using it more and more as a diagnostic. In fact, there's a company that just by wearing a wearable like an Apple Watch or an Android watch, we can actually monitor Parkinson's disease. This is FDA approved. You can monitor a whole host of medical conditions, and it uses artificial intelligence to refine the detection software. We also use it in imaging. And we use virtual reality and augmented reality during surgery. George Washington University Hospital has a augmented reality program where the surgeons can actually wear goggles during the procedure and see their way through the brain or the spine to get to the target of what they're trying to achieve. So although we should be somewhat mindful of artificial intelligence, there are ways we can use it to benefit people as well.
Are you finding, as this technology is starting to become a little bit more mainstream and people are starting to talk more about it, that patients are receptive to it, or do they end up having some resistance to this type of new technology?
I think a lot of patients really engage in it. A lot of my patients come to me with their MRIs or CTs or reports fed into an AI and then telling me, well, this is what AI told me I have, is this right? Or asking me, what would you do? This is what AI said. Mm. So, and I always tell them, I'm glad you brought this here. Let's go through this together. And understanding that the human part of this is I have to make judgment calls based on benefit and risk. And AI is giving you a good overview of what's going on, but then that human experience helps sort of soften the edges of what AI can offer.
And talking about the human experience, I know one of the things you love so much is watching patients get better right in front of you.
My brand of neurosurgery is really one of those things where the personal satisfaction is amazing. I meet somebody like Rick, and I can see that he's got this tremor, and that right on the table in front of me and in front of him and in front of everybody in the room, the tremor stops. It's everybody who's in the room, especially the medical students and the residents who are there who see this for the first time, they always say, that was magic. And this is where science and technology looks like magic.
It's incredible. And how has your life been different since this procedure?
Well, just small ways. I mean, the most immediate thing is that I can deal with hot liquids. I'm not. I used to be, if I was on a plane or something, and the flight attendant offered me coffee, I would have to say, "Well, could you please put it on a tray for me?" And now I can just put my hand out and carry it. And other things, like you asked about a signature, like I have a signature again, just so little things like that. But I also, in terms of like just meeting people, like strangers, I have a lot more confidence in terms of I don't have like, it used to be that I would meet people when after 30 seconds, are you okay? I mean, you got this, your hands are shaking and everything. I'm like, no. That's nothing. That's just, now it's just not there, so I don't have to deal with that.
So it's almost like you had to explain what
I
you were
had to
going through to
explain,
everybody,
exactly,
and now you can just focus on the conversation at hand.
Yeah.
And Dr. Levine, I know that seeing the outcome, it's got to warm your heart quite a bit. Is this the outcome you hope for all your patients?
Yeah, and I've been doing research in this kind of thing since I was 17 years old. This is something that I really is a part of who I am. And being able to see somebody get better in front of you and offer them something like this, and hearing Rick's story, and it, like, I don't get that all the time because the patients don't talk to me like this all the time, but I see it, and I see the gratitude, and it's why one goes into medicine.
For patients who want to learn more or they want to make an appointment, what's the easy next step?
I guess the easy next step is to contact through George Washington University Hospital. We will get you in for an evaluation, and you may need to see a neurologist before you see me. But either way, we will sort of walk you through the process and see if you're a good candidate, and then see if the treatment's good for you.
It's great. Dr. Levine, Mr. Desper, thank you both so much for joining me. Again, we have Rick Desper, a patient at George Washington University Hospital, Dr. Zach Levine, a professor of neurosurgery at George Washington University Hospital. I'm Lindsay Mastis, and for more information on this series, you can go to WTOP.com and search Get on Top of Your Health.